back to the Dr. R Show. We're here again with Dr. Mitch Abrahams, who specializes in complex kidney surgeries. Welcome back, Dr. Abrahams. Now let's switch gears and talk about kidney cancer. What is kidney cancer?
Well, kidney cancer is a tumor that develops in the kidneys. When a tumor forms, basically the cells that were supposed to be there get the wrong signal, and they keep making more and more and more cells until an actual three-dimensional tumor is developed that gets in the way of the normal kidney function.
And how many types are there?
Well, there's two main types of kidney cancer. One is cancer of the so-called parenchyma, what you might think of as the meat of the kidney. That's where actually all the cellular work is done that makes the urine. And that's what we call renal cell cancer. That's the far more common type of kidney cancer. And then you can also get cancer of the urinary tract of the kidney. That's called transitional cell cancer. So those are the two main types.
And which of the two is more aggressive?
Well, it actually turns out that the less common, the transitional cancers, is more aggressive. That's the cancers of the urinary tract. So for those, we have to be much more aggressive in our treatment to make sure that we eradicate it.
And how common is kidney cancer?
Actually, kidney cancer is not one of the most common cancers, not like breast or prostate, but it's fairly common in the next sort of tier of incidences. In the United States, about 60,000 people will get kidney cancer in 2015, approximately, and about 14,000 of those people will die from kidney cancer. So you can see from the statistics that most people who get it are treated in a way that they survive long term. It's highly treatable cancer.
And that's both renal cell and transitional?
Those are the numbers for the renal cell cancers. Transitional cancers, probably about 20% of those numbers, so it's a much more less common cancer.
Now, what are the risk factors? Who's getting kidney cancer?
Well, kidney cancer is mostly a disease of people in their late 50s, 60s, and early 70s, although unfortunately we're seeing more and more younger people with it, and that is not clear why that is. There's not a lot of risk factors that have been exactly worked out, but there is a connection with people who smoke or were exposed to smoke, and there is a connection with people who are obese. But other than that, the far majority of our patients don't fall into those categories, and so it's not clear why they developed it. Transitional cancer, which is the cancer of the urinary tract, very, very strong relation to smoking. A lot of those patients are smokers or were exposed to smokers. And also people who work in industries with benzene, dyes, and things like that.
What are the signs and symptoms? How does somebody know they have kidney cancer?
Well, most of the patients we see now that have kidney cancer actually have no symptoms. A lot of these patients are picked up because they get an x-ray for some other symptom. Maybe they had a tummy pain one day or some nausea and their doctor ordered a scan and we found it what we call incidentally. So for renal cell cancers, that's the most common presentation. Second to that, people might have some blood in their urine, either that they can see or that their doctor can pick up on screening tests. Definitely for urinary tract tumors, blood in the urine is the #1 way that those are picked up.
And how do you stage a cancer? I understand there's different stages to kidney cancer.
Sure. So let's split up the two main types of kidney cancer. So when we're talking about renal cancers, that's the ones that are in the meat of the kidney. Most of the patients are stage 1. And a stage 1 tumor is any tumor that's contained in the kidney that's less than 7 centimeters. So that's about 3 inches roughly. So it goes by size. Stage 2 tumors for that type of cancer are ones that are bigger than 7 centimeters, but still contained in the kidney. Stage 3 disease is when it has invaded into the tissue next to the kidney. So that would be the fatty protective layers of the kidney or the major blood vessels near the kidney. And then stage 4 is if it goes into an organ next to that. So if it goes into the adrenal gland or the intestinal tract, pancreas, spleen, liver, anything like that, that's stage 4 disease. Now, the transitional cancers, which is the urinary tract cancers, those are staged based on the depth that they go, so not the size. So stage A disease is actually just on the surface of the urinary tract. Stage 1 is a little bit deeper into the wall of the urinary tract. Stage 2 is in the muscle underneath the wall of the urinary tract. Stage 3 is when it goes actually into the kidney, so it actually invades through the wall of the urinary tract into the kidney. And then stage 4 would be if it went into something nearby.
So for renal cell kidney cancer, what are the treatment options? How do you treat that?
Well, the number one treatment we do now in our center is what we call robotic partial nephrectomy. So basically, this technology came out in the late 1990s, but wasn't really widespread used for kidneys until about the last 5 to 7 years. And basically what we can do with most patients is through very, very small incisions under an anesthetic, of course, we go in and actually cut out the cancerous part of the kidney and reconstruct the good parts of the kidney. So we sew together the urinary tract, we sew together the blood vessels that need to be closed up and the outside of the kidney, and we do all that all through little teeny tiny incisions using the Da Vinci robot. That's our number one treatment now. Now, if you have a larger tumor or a tumor that we think is invading, then we usually do telescopic surgery to remove the entire kidney. That's called laparoscopic nephrectomy. Very, very uncommon, but still occasionally needed. Some people have to get chemotherapy. Some people have to get what's called immunotherapy, medicine to boost your immune system to fight the disease. That's for people who have disease that has spread other places in their body, or for people who can't have surgery to cure them. And then even more rare than that would be radiation, say for example, kidney cancer that goes to the bone or goes to the brain or something like that. They'll be treated with 3D radiation therapy. Now that's for renal cell cancers. Transitional cell cancers, almost all of those patients will require full kidney and ureter tube removal. It's actually kind of 2 operations in one. We do those robotically and laparoscopically as well. A very rare potential for those patients, if they had a really small superficial tumor, would be for us to use a similar ureter scope like we showed for the stone disease to laser the tumor. That would be mostly if they had a very, very small tumor, or if they only had one kidney, say the other kidney had been lost to some other disease, we might have to use that.
Great information, Doctor, and thank you for being on the show. And thank you for watching this edition of the Dr. R Show. Until next time, healthy living and goodbye.